Hello, everybody. Welcome to today's Research America Alliance discussion. I'm Jenny LeRae, your moderator. And for the past several weeks, we have hosted Alliance discussions featuring the honorees of our 2024 Advocacy Awards. And I'm looking forward to another of those conversations today. Thank you so much for joining us and for your partnership in the Research America Alliance. I'm very excited to introduce today's special guests, Dr. Joanne Pike and Tony Gonzales of the Alzheimer's Association. The Alzheimer's Association is the very well-deserved recipient of our 2024 Paul G. Rogers Distinguished Organization Advocacy Award. That's a mouthful, but you get the drift. The Alzheimer's Association is quite a force in patient advocacy. Dr. Joanne Pike is president and CEO. She joined the Alzheimer's Association in 2016 and played a number of leadership roles, becoming president in 2021. Tony Gonzales was diagnosed with mild cognitive impairment in 2021 at the age of 47. And he works to educate others about the importance of early detection and diagnosis, especially those in the Hispanic community. Before we get started, I'll note that both of their bios are in the chat and are worth reading. And I'll quickly remind our audience to please type your questions into the Q&A box or the chat box, and we'll pose as many as we can with the help of my wonderful colleague, Jacqueline, during the Q&A portion. So thank you so much for joining us today, Joanne and Tony. Let's get started. Can you tell us a bit more about yourselves? And I think, Joanne, we'll start with you, how you first became involved in the Alzheimer's Association.
First off, Jenny, I just want to say thank you for this opportunity to be with you and the virtual community today to talk a little bit about the Alzheimer's Association, and certainly honored to receive the award from Research America. I've had a public health career that is inclusive of other large voluntary health associations for over 20 years. As you mentioned, I joined the association in 2016, and I've certainly been honored to be a part of what has been tremendous progress addressing Alzheimer's and all other dementia.
That's wonderful. And Tony, let's hear from you. How did you first become involved? We know just a bit about your personal story.
Well, thank you again for this and for the support that Research America has given us. It's a pleasure being with you today. I was diagnosed with mild cognitive impairment at the age of 47 years old, something I wasn't prepared for. I first noticed some of the changes when my son was about to get married. I had some memory issues that were popping up and I was getting lost. So it was a long path to diagnosis. But once it came immediately, I contacted the Alzheimer's Association. And I really haven't looked back since. They gave me the support, the love, and the need, not only for me, but for my family too. Every chance now I get, I tell my story and I encourage other people to do the same thing.
And could you tell us a little bit about the blue flower that you have on your lapel? And I think I see a whole
Sure.
assembly of beautiful flowers
Sure.
behind Joanne.
So the flowers are important to us at the Alzheimer's Association. They represent those that are volunteering and working for an end, for our mission, an end to Alzheimer's and other dementia-related diseases. Behind Joanne, yeah, you can see those other flowers. This is my flower. This one represents someone living with the disease. I wear it proudly in my community. I'm so happy to have it, and I'm glad the association has something like this for me to share because, as you can see, nobody would be able to tell that I have the disease, but this one, I can proudly say I'm living well with the disease.
Very good. So I know that the Alzheimer's Association is very involved in working with policymakers, and not only towards specific policy changes, but also increasing awareness of what has really become a public health crisis in terms of people living with dementia. So if you could each share with us recommendations that you have for policymakers right now around strategies for addressing this public health crisis. And Joanne, let's start with you again.
Thanks. And I think it's an important point to note that, what is that public health crisis? Right now, over 6 million Americans are living with Alzheimer's, and there are over 11 million Americans who act as a caregiver. So the size, the scale of this is part of what makes this a public health crisis. The other part is readiness. Are we ready to deal with a growing aging population that will be dealing with this more and more over time? I think it's important to also acknowledge that we have been making tremendous progress with our bipartisan congressional champions in Washington and lawmakers across the country, but we have certainly a lot more work that needs to be done. Much of the answer is in that question, though. Alzheimer's and other dementia are a public health crisis, as I mentioned, so we must address it like that. This requires us to think about every lever available to us to create change, whether that's individuals, to systems, to the environmental change that is required, to the policy approaches within that. And since 2018, Congress has been investing in our nation's Alzheimer's public health infrastructure through the BOLD Infrastructure for Alzheimer's Act. BOLD stands for Building Our Largest Dementia Infrastructure. This law is helping state and local public health departments implement Alzheimer's interventions for everything from risk reduction to caregiving support, along with system level change in diagnosis. However, as we are now in this new era of treatment, it's really important that we ensure that early and accurate diagnosis is available, and that treatment is not just about getting people to what is potentially the new treatments that have come to market, but also quality person-centered care that is available to those who are diagnosed, but also their caregivers as well.
Thank you, Joanne. Tony, when you're meeting with policymakers, where do you start?
For me, when I first came to the association, one of the best things I was told was, Tony, you're an expert in your disease and your journey and who you are. That gave me so much power. And I took that and decided I need to share my story. So for me, it is a public health crisis because I live in a town filled with Hispanics that are 73% is the population of Hispanics in our town. So although it is a public health crisis for the world, really, if I bring this smaller, from my hometown, from my family, my friends, the people that I see at the grocery stores, this is a public health crisis for them. So the first thing we need to do is listen to those experts, the ones living with the disease, the ones that know what they're going through. Listen to their care partners, the ones that know what those need in order to allow them to live well within their communities. That's what we're asking for from a lot of these advocates to ask for their lobbyists.
And Tony, I think you've just listening to you is a partial answer to this next question, which is, what advice would you give to other research advocates? What is the best path to have meaningful impact for folks who have already started their patient advocacy journey or are contemplating about whether or not they want to become a patient advocate?
The first thing you really need to do is talk within your team. I always credit my wife for saving my life, but it was the communication with her that she helped communicate with my family and friends. And then beyond that, it's my experience that my fellow advocates have to learn how to be able to tell their story. They think that nobody wants to know, but we when we tell our story, it makes it personal and it makes it real. This is a real disease happening with real people, and we have real solutions now. So this is the time to tell your story.
And Joanne, I know you work with, obviously, very closely with Tony and many other patient advocates. What advice do you give your colleagues when they're starting their research advocacy journey?
Exactly.
And I guess that also goes for non-patients as well, family members or others who feel a calling to advocate on behalf of research for patients.
I think Tony said it best. It's about telling your story and being honest with where you are within that story. Like Tony, I wear a flower as well. I wear the yellow flower, which signifies caregiving, and I talk about what that journey looks like for our family. What we know at the Alzheimer's Association is that every advocate, every volunteer, our employees, they all have a story that drives them for that personal advocacy. talking about your loved one, your own fears, how the disease is impacting your life is compelling. And,
Mm-hmm.
people learn from that. And, policymakers certainly are listening to those stories. And then not only do you tell it once, but then be relentless in your pursuit. Keep sharing. Always do this respectfully as you're building a relationship, certainly within the advocacy groups and with your policymakers and their staff. But be relentless. Always center yourself within that story because it's powerful.
Jenny, if I can share too, when I had a
Please.
chance to go to the international conference that we have, AAIC, one of the young researchers came up to me after my very first speech, and I was very nervous. He immediately walked up and said, "Thank you." And it was the first day, I don't even think the conference had started, but said, "Thank you because you gave me a reason to work again, a person to work for."
Mm-hmm.
So telling these stories is important for these researchers to hear because they're doing all this hard work.
Mm-hmm.
They need to put a real face on it.
Yeah, that's such a great point. So we talked about uh, communicating with policymakers. How about the general public? What does the public need to know about the dementia public health crisis? And are there any disconnects between commonly held beliefs and the realities on the ground? Joanne, you want to take a stab at that?
I might focus on two items. First, there's growing scientific evidence that there are things individuals can do to reduce their risk of dementia and improve brain health. For example, we know what's good for your heart is good for your brain. The Alzheimer's Association is funding and implementing a research study in 5 communities nationwide called US Pointer, where we're looking at a clinical trial to evaluate whether lifestyle interventions that simultaneously target many of those risk factors that protect cognitive function in older adults can increase the chance of decreasing that risk for cognitive decline. So there are things that we're learning about community intervention that we'll be able to apply, hopefully, as that research study is finalized. Second, there's still a significant amount of stigma associated with changes in
Mm-hmm.
cognition, both for individuals and medical providers. And we need to break that cycle. And the only way to do that is to address concerns proactively. So if you or a loved one are experiencing memory changes, talking to a healthcare provider is incredibly important to make sure you're building an evaluation process for those changes. With FDA-approved treatments for people in the earliest stages of the mild cognitive impairment due to Alzheimer's disease or the earliest stages of Alzheimer's disease, early detection and diagnosis become even more critical to ensure individuals receive that potential benefit of the treatments that are coming out of the pipeline.
And Tony, when you're doing your advocacy, let's say within your own community, what are some of the misconceptions and beliefs that you try to turn around or give folks another way of looking at
Sure.
this issue?
It's twofold. Getting a diagnosis is extremely hard when you're this young. And for lack of a, I mean, I look pretty healthy for the, for today. I look pretty healthy. Nobody would ever think that I have something wrong with me. The other thing is that it's just a memory thing, that it's only memory stuff that happens. There's a
Mm,
whole world behind all of this. It's the
mm,
understanding of it all. For me, I was really lucky. I was diagnosed within 2.5 years. I think the average is somewhere between 3 and 5 years.
mm.
Some people even go their whole lives without being diagnosed. Now, you think of the people in my hometown who don't speak the language, who don't know the health system, who don't have the education, who don't have the money. It's almost impossible for them. So what's wrong is we need to get in and help these health systems. I'm very, very happy with Joanne and our entire staff who are working extremely hard to make sure that the medicine and the therapies and the information all get out to America, but more importantly, to those that really need it in those areas where we know they're not getting the information. So
Is part of your the education you do to help people see that that diagnosis is not an endpoint. It's really a beginning. I mean, is that part of your message? Not to
I don't
put
know.
words in your mouth.
It's a part of survival. When
Mhm.
when when I was faced with this, my wife She literally said, honey, I can't help what's happening to your brain. There's nothing we can control about that, but we can control your environment. All those other therapies like art therapy, music therapy, socialization,
Mm-hmm.
eating well, all the things that Joanne was speaking about earlier. Do what's good for your brain, good for your heart, is good for your brain. All of that beyond the medicine is going to help those that
Mm-hmm.
are in the early stage, the mild stage. And that's the stuff that we need to be thinking about too.
Got it. Got it. Really, really well said. Dr. Pike, in the last few years, there have been some incredible advances in treatments for Alzheimer's disease. What are some of the new breakthroughs that are becoming available?
This is great. This has been an incredibly exciting couple of years in Alzheimer's research, both for treatments and also for diagnostics. Fact is, we now have treatments that target the underlying biology of the disease versus only the symptoms, which was the historic treatment. There are now 2 FDA-approved Alzheimer's treatments that change the disease progression in people living with Alzheimer's, and a third is on the horizon early this year. Obviously, the audience may have also heard the news yesterday that Biogen will discontinue one of these treatments in the coming months, which is disappointing for the people who are on the treatment. And we know that there will be conversations between those individuals, their healthcare team, to discuss how that decision from Biogen will impact their treatment and care. But despite this news, we are extremely optimistic about the future of Alzheimer's treatments and care overall. This fall, CMS expanded coverage of amyloid PET scans, which is an important diagnostic tool.
Mm-hmm.
And now there's going to be new, easier and more affordable diagnostics that are on the horizon, like blood diagnostics.
Mm-hmm.
And that's really encouraging because, what all of this does, the advances that we're seeing in both treatments and diagnostics, it brings unprecedented levels of private and public investment into prevention, treatment, and ultimately cures. We're also proud of our own ability to impact global research overall in the global research portfolio. In 2023, the Alzheimer's Association celebrated a monumental achievement. We made an astounding $100 million investment into research initiatives. This 100 million single year investment is illustrative of the momentum we're building in dementia research. Certainly, our investments today will lead to breakthroughs tomorrow. But the fact is, we wouldn't be here. We wouldn't see all of these advances coming out of the pipeline now without our donors and our advocates through their tireless efforts of working with bipartisan congressional champions. Federal Alzheimer's and dementia research funding is at an all-time high, and our nation is implementing an Alzheimer's public health infrastructure. Today, the NIH, the National Institutes of Health, is investing more than $3.7 billion annually in Alzheimer's and dementia research. It's an incredible growth over the last decade.
That's really exciting. What would you say are the association's priorities for this coming year?
Thank you. We need to keep the momentum going, ultimately. And to do so, Congress needs to renew its commitment to addressing the Alzheimer's crisis. As an immediate action, we have a couple of things right now on Capitol Hill that need to be looked at and passed. So one of those is passing the National Alzheimer's Project Act, the NAPA Reauthorization Act, and the Alzheimer's Accountability and Investment Act, both of which are set to expire very soon. And the BOLD infrastructure, that building our largest dementia infrastructure that I mentioned earlier for Alzheimer's Act, which is making tremendous impact in communities across the country, is also set to expire. So we're working with bipartisan champions in Congress to ensure the commitment they made in passing the NAPA Act more than a decade ago continues. And of course, we continue to work with health systems and payers to ensure they're covering these treatments as they receive approval and the diagnostic tools that go along with them. We also know that sustained investment in medical research at the NIH is essential to continuing on the path that we're seeing in finding new treatments, preventions, and innovations in care. So we're hopeful Congress will come to an agreement soon on funding levels, and that we will once again see an increase in Alzheimer's and dementia research funding.
Well, certainly you and your staff and your volunteers are going to be be quite busy, but you're clearly making a lot of progress as well. Tony, I'm going to turn to you for a few questions and then we'll turn to our audience. So please continue to put your questions in the Q&A or the chat. Tony, talk about the importance of clinical trials, your experience exploring. I know that you weren't able to be in one, but you did explore them. What can you share about that?
Sure. Well, first of all, I'm so appreciative and so thankful for all of those in previous years that have been a part of trials. Every part of that has been helpful to where we are now. So thank you to everybody who has done that. Unfortunately, in my area, yeah, I couldn't participate in a trial. I reached out. I did everything I was supposed to do, but I was under the appropriate age. I was in what's called a medical desert. So it was impossible for them to come pick me up and drive me. But the good news is I'm in some great support groups put on by the Alzheimer's Association. And in that group, I have some friends that did participate in trials. And I saw the success that they have. I saw them start to get the brain fog start to disappear. And I saw them start to have hope again, which again gave me an extreme amount of hope. Clinical trials are very limiting, yes, but we need to open those up even more. And if you can be a part of a clinical trial, whether you have the disease or not, it's extremely important. And you're doing something for somebody just like me. So thank you for even considering doing it. But being a part of a clinical trial is extremely important.
It sounds like that's a part of your education when you're out there in the community as well.
It is. It really
Yeah.
is. It's an important part of it.
What advice do you have for family members, caregivers who are just starting out in this journey?
Oh boy. So first of all, have extreme amount of patience. You're going to need it. You're really going to need it. I always say to communicate and I always say to lead with love, but really you need to reach out to people that can support you. Find your community. Of course, that matters in the home, that matters in the city, but that matters outside of that too. Like the Alzheimer's Association, your churches, find the community that's going to help you live well in your community. But also, it's very important that you take care of yourself. When I first was diagnosed, I was 185 pounds heavier. I did not do brain activity exercises. I was not very good at taking care of myself. That's changed, not just because of the disease, but because I learned that's how I'm going to keep myself healthier longer. That's the easy way to make it very simple for you. How do you stay healthy? You live a healthy lifestyle.
Wow. Well, you've answered what was going to be my last question before we went to audience questions, which was what advice do you have for people living with dementia who have been recently diagnosed? But if you'd like to add to that, please do.
Live for today, no matter what. Live for now. Be present where you are. This disease, although yes, has limited maybe some things in my life and has taken some memories, but the newness out of it, the birthing of new talents, new friends, new opportunities, well, somehow I'm almost grateful for the disease some days.
Well, your vitality shines right through.
Thank you. Thank you very much.
So this has been a wonderful conversation, Tony and Joanne. And now we're going to turn to some audience questions, and I'm going to ask my colleague Jacqueline Lagoy to join us on screen. Jacqueline, any questions from the audience?
Yes, thank you, Jenny, and thank you, Tony and Dr. Pike. This has been an excellent and very inspiring discussion. So for our first question, we have a couple of great questions, one from Mark Johnson and one from Lucinda Main, about the possibility of environmental factors contributing to Alzheimer's. Joanne, can you speak to that variable?
It's an area that we are certainly learning more about all of the time. And it's a great example of why we need to continue investments into understanding risk factors and ways that we can mitigate risk for Alzheimer's overall. So we know that there is a growing body of research that does tie environmental factors, pollution, with Alzheimer's or another dementia. And we need more research on that to really understand the connection and what we can do about it in the future.
Thank you. So for this next one, this is for Tony. What's been the most unexpected part of your diagnosis?
This whole experience, the whole human experience, as I call it, has been very, very different. So there is the not remembering anyone. There's a lot of little things along the way. But I think at the end of the day, it was really finding the true meaning of life. And for me, that was the people around me, having the moments around me and living and being present and living with love. It sounds corny, but really, at the end of the day, that's what it is.
I agree 100%. This next question is also for you, Tony.
Sure.
You testified to Congress to share your story
Yeah.
and spoken in media. What's the hardest part or the best part of doing that?
It is extremely hard to travel with this disease, but I do it because it's the right thing. And I also love to travel. I love going places with my wife. Those things that are hard are some of my symptoms that start to come out are shaking, sweating, non-filter. These are things that I have to deal with in life anyways. But I think that the traveling is probably the hardest, but it by far is worth it. It is one of the most important things that we do because we need to be with people. We need to see them face to face. My friend Joe Arciniega once told me, "You'll never know the amount of people that you helped, but it's kind of fun to meet them every now and then at a summit or at a forum."
Wonderful, thank you. So our next question, what is the top priority and what needs more or better work now in this area? I'll let either of you take it or
I
feedback.
might
Go ahead,
start, and then
Joanne.
Tony, I would love to hear your opinion on this one too.
Sure.
Um, I think there's a couple of things. So, I mentioned some of those legislative priorities. We have some pieces of legislation that need to be reauthorized. But, a big piece of what we've learned as innovations have come out of the pipeline is, are we ready as a society? And the fact is we learned we're not. We have a lot to do with the health system infrastructure in order to enable diagnosis, treatment, and the care journey in a way that is evidence-based and builds capability within those health systems and within our physician population.
That was going to be my answer too. It's health systems. It's our health systems. It's getting out there and helping them have these conversations with their patients. We want to have the conversation. If your patient wants to have the conversation, let's have the conversation. But the door is closing too many times. So I agree with Joanne. That's priority number one.
Great, thank you both. And I think I have time for just one more, and I'll turn it back to Jenny. So this attendee, she says her mother has Alzheimer's and she's worried she'll also get it. Can you talk about genetic risk?
Well, genetic risk, just because I might start with, just because a family member has it does not mean that it is predetermined for any other person or individual. However, it might increase your risk overall. And having concerns and being able to talk about those concerns with your own provider, whether that be a nurse practitioner, physician's assistant, or your doctor, is important to make sure that you're understanding what that means for you over time. And as Tony mentioned, there are things that you can do today from a lifestyle perspective that we've learned help potentially reduce your risk as well. So do the things that are good for your heart that are going to be good for your brain as well. Follow up with your physician or your healthcare provider, and also understand that things are not predetermined, but they may just increase your awareness and your risk over time.
I always laugh at my son because he was the first to say, "Well, what happens to me?" when I told him I had something wrong. But it's true. They're going to learn from us, and we're going to be that mentor and show them how to live that healthy lifestyle. So I want them to have that conversation.
I'm going to sneak in one last question from someone in our audience who wanted you to comment on the potential impact of new technologies like AI, RNA programming, spectrometry, etc. Either of you, any comment on the potential impact of these new technologies on Alzheimer's, both treatment and prevention?
Yeah, I think there is such a growing body of potential innovation out there in multiple places. It could be coming from AI, as this individual acknowledges, it could be coming out of a diagnostic pipeline. And I think ultimately, one of the things that we have to think about is awareness and knowledge that comes with a booming business around innovations that are going to be coming out. So awareness of what is this product? What does it mean? What is the research behind it? What is the validity of that? We need to think about what it means for these specific products, but it's only going to raise the awareness among individuals for their own cognitive health, and hopefully raise the potential for individuals to have conversations with their care provider about any questions or concerns they have. At the end of the day, technology still requires us as humans to interact around that. And what we learn or what we can gain from that is incredibly important for our own health and what you do with your primary care provider.
Thank you, Joanne. That is all we have time for today with both of you, Tony and Joanne. And what a really inspiring and edifying conversation. We can't thank you enough, and congratulations again on your award. And we look forward to seeing you in person at our award ceremony on March 13th. So one quick announcement before we end. Please join us for our next Alliance discussion on Tuesday, February 6th at noon Eastern. And we're going to be featuring a leading expert in the antimicrobial resistance field. That's a topic that Research America has been focused on for quite some time. We'll be speaking with Dr. Elaine Larson, who is the Anna C. Maxwell Professor Emerita and a special lecturer in the School of Nursing, as well as the School of Public Health at Columbia University. She is going to provide some new details about the AMR threat and also how we can chart a path to ensure that antibiotics continue to be an effective part of our disease arsenal. So join us next Tuesday. And thank you so much again to Tony and Joanne and Jacqueline and everyone who was with us today. See you soon.
Thank you all very much. We wish you good brain health.
Thank you.
Thank you.